the trouble with us is that we are all too broken into specialties and subspecialties and subspecialties, and one specialty never speaks to another specialty, so nobody really puts the whole thing together, when actually we are one big complex organism. And today I want to show you, or try to show you, that one thing that brings everything together in our physiology, cardiac and general health, is the vagus nerve. And we've kind of ignored the vagus nerve for so many years. Nobody talks about the vagus nerve. And even when they do, it's just in a way that doesn't grasp your attention. Hey, this is important stuff. And I'm going to show you why it's important. So hopefully, when we're done with this, you should be motivated to realize that the vagus nerve is very important. And a lot of the ancient wisdom revolved around the vagus nerve and keeping it healthy and keeping it functional. Whether it is exercising or breathing exercises, slow breathing, inspiration, expiration, yoga type postures, holding your postures, whether it's to do with diving in cold water, or resting, sleeping. What's the vagus nerve doing during all this time? And what can you do? This is a clue to hack your vagus nerve. Today, hopefully, I'll teach you a few tricks to hack your vagus nerve. And if you hack your vagus nerve, you'll get a lot of good benefits. And we need to hack the system here. If we can hack the internet, can you hack the internet for me, please? So if we can hack the internet, we're going to hack something. Okay. So the vagus nerve is the 10th cranial nerve. It starts all the way in the midbrain. And what's its function? It's called the vagus because it's everywhere. It's a vagabond. So it goes all the way out. It gives branches. And you don't know this, but I'm telling you today, it gives branches to your eyes. Did you know it goes to your eyes? It goes to your eyes. Then it goes down into your pharynx, the throat area. It goes to your voice box down here. It goes to your facial muscles. It goes all the way down in towards your esophagus, to your heart, to your lungs. Then it goes down through the diaphragm, goes down into your stomach, your small intestine, your large intestine, your pancreas, goes everywhere. And what it's doing? It's collecting information, and then it's delivering information, telling it what to do. It's your software. Your vagus nerve is your software. This is your hardware. Your hardware doesn't know what to do unless there's software, right? Am I right? Engineers? Your vagus nerve is your software. It's telling your hardware what to do. It's telling your intestines what to do. It's telling your heart rate what to do. It's telling your contractility, your blood vessels to constrict or vasodilate. Because you can't have the same software at all times. How can you have that? You can't have one operating system all the time because your environment is changing. I walk into that room, I come back over here. It's a different environment. Everything changes. My body has to react. And who's making all these instantaneous changes that are happening in your body? Nobody thinks about this. It's your vagus nerve that is doing a lot of the orchestration of the moment to moment, minute to minute, second to second changes in your body is being done by your vagus nerve because it's sensing and sending out efferent. It's one of the few nerves that actually has both sensory function and motor function. So in the heart, you all know that if you take a deep breath in, and then you take a deep breath out, when you breathe out, your heart rate slows down. And you know about this because on your Apple Watches, it'll tell you what your heart rate variability is. What is heart rate variability? That means when you breathe in and you breathe out, there's supposed to be a change in your pulse. Your pulse rate doesn't stay the same all the time. If I'm 80 beats per minute, it's not 80 all the time. It's 78, 80, 82, back to 78, 80, 82. It fluctuates. It's called heart rate variability. Because when you breathe in, the lungs, the sympathetic fibers go up to the brain, and then when you expire, your vagus nerve gets stimulated, and it slows down your heart rate. So your heart rate changes according to your vagus nerve and your sympathetic system. That is why if you want to hack, I'm going to start straight away by telling you how to hack yourself. So if you want to hack your vagus nerve, take care of that right there. Don't tell someone who's stressed out to take a deep breath in. Time to take a deep breath out. Look at yourselves when you are stressed out. You're holding your breath. You are like this. No. Take a deep breath in, fine. But take a deep breath out. Breathe out slowly. Long, prolonged expiration is what you need. So the trick is, you're feeling stressed out, breathe in to the count of 4 or 5. Breathe out to the count of 10. Breathe in again to 5, breathe out to the count of 10. When you're breathing out to the count of 10, you're stimulating your vagus nerve. When you stimulate your vagus nerve, I'll come to the chemistries of everything else in a minute, but basically you want vagal activity. You want parasympathetic nervous system. You don't want sympathetic. There's enough sympathetic out there in this world already. All of us are stressed out to the hilt, right? Too much sympathetic, on the go, adrenaline, all the time. Our heart rates are there, 80, 90 all the time. Never goes down. There's no heart rate variability going on. You're constantly making adrenaline all the time. When are you healing? If you're getting the yin, where's your yang?
I know I'm stressed out right now.
You see?
Just need your password.
You see what I mean?
Just need your password. You should be good to go.
Yeah. There you go. But you see, when this is done, I'm going to tell him not to take a deep breath in. I'm going to say, take a deep breath out. Very different. Breathe out, nice and slow. And immediately, so what happens? Your body, think about this. Your body is all stressed out. All the adrenaline's running inside you. But now you're breathing slowly out. The brain gets confused. Wait. How can you be breathing in a parasympathetic mode when actually you're supposed to be in a sympathetic mode? In a sympathetic mode, you're supposed to be breathing fast, right? So let's say you see a lion, you're supposed to see the lion, your heart rate goes fast, right? You're stressed out. But here, you're in a lion situation, but you're breathing only 10 times per minute. That doesn't make sense. So automatically your brain shuts off your sympathetic machine. Did you get it? You see, you just hacked your nerve. You hacked your 10th nerve. Because in that situation, you turned off the chemistry. You cannot have the yin and the yang at the same time. So, the trick I'm teaching you here on hacking that nerve, just on the breathing, because we started talking about the breathing. I'm a little off my slides right now, but that's fine. Because when you're breathing out like that, it's incongruous with what's going on. Doesn't make sense. You're supposed to be breathing fast. You're stressed out, but you're not. You're breathing slow. So I'm telling you that in any stressful situation, you can change your chemistry in your body. You can turn off that bad stress chemistry by doing prolonged, slow expiration. So you breathe into the count of 5. Then breathe out to the count of 10. And when you're doing this, don't breathe into your chest. You're doing abdominal breathing. So your diaphragms are moving down, and the diaphragms then move back up again. So when you're breathing in, your belly button must come forward and meet your hand outside. So you'll become pregnant when you breathe in. And then when you breathe out, the stomach goes in. Look, the chest doesn't move. That's the breathing I want you to do, because now you can hack yourself. You're going to hack your vagus nerve. Your vagus nerve is very important. It's the yin and the yang. The vagus nerve is what's going to repair you. The vagus nerve is going to put you back where you belong. You need the sympathetic for stressful situations. When the lion comes, don't just sit there. You better do something. You need that sympathetic. But as soon as the lion's gone, then you need to be relaxed. Look, take for example the sable. When I went to do my safari, the sable would run crazy because the lion's chasing it. But after the lion stopped and gave up, then what does the sable do? What does he do? Starts eating grass. He's relaxed. He's not bent out of shape for the rest of the day, which is only a human trait, that we continue to carry what just happened on for the rest of the day. He's now parasympathetic. If you look at his heart rate, it shot up to probably 200 beats per minute, and within a couple of minutes, his heart rate is back down. Back down. So let's hack the situation in another situation I'm going to give you. I'm exercising. So how does Dr. J exercise? I do very fast speed exercises, and then I completely lie down and rest. Why? I said, wait a second, this guy was on the machine just now, and now he's lying down on the ground. Right? Why? Because it's incongruous to my sympathetic. I'm turning off my sympathetic system real fast, and I'm bringing in my parasympathetic system real fast. Got it? So I'm training my nervous system to say, okay, bring on the yin, fine, no problem, but bring on the yang as well, quickly. Bring on my parasympathetic system very quickly. And when I teach this to my patients, and they actually do it, they feel great because it's like recovering much faster from that acute state of sympathetic. You're now bringing in that parasympathetic, and you bring it on real fast and real hard. So what I do, I don't like to see people doing exercises. They jump onto that treadmill, and they're doing it for a good 45 minutes non-stop all the time. And then when they're finished, then also they kind of just slow down for a little bit. No, wait a second. You don't do that. If the lion was chasing you, you run real fast, and then you slow down, stop completely. The lion's gone now. Now you just sit and you just relax. And that's what you should be doing. That's how I like to exercise too. I like to exercise fast and then nothing. Just lie down, nothing happening. And breathe real slow. And the slow breathing doesn't mean slow in, it's slow out. Because what are you doing to your vagus nerve? You're hacking it, right? So you all need to learn how to hack it, because your vagus nerve is very important. It's the rest and relaxation nerve. It restores and repairs. It's anti-inflammatory, because everything else is inflammatory. Anything you do is inflammatory. Eating is very inflammatory. I just happened to see someone eating in the audience. So right after the eating, you need anti-inflammatory. I told you eating is dangerous. You want to restore all that muscle that you tore, all that running around, all that chemistry running around. Your platelets became sticky. They need to become unstuck. Platelets become sticky. You get stressed out. Of course you're going to get a heart attack because your platelets are going to get all sticky. In parasympathetic, the platelets start flowing around again. They're no longer sticky. And these studies have all been done. That acute stress causes degranulation of your platelets become sticky. So what makes them become unsticky? What makes the platelets not degranulate? Your parasympathetic system. See? That's why it's so important to do this. And then it is the relaxation. Relaxation. All that tone has to change. You can't stay in that tone. It has to relax. That's your parasympathetic. Digestion. You need to digest. When you are digesting, it's parasympathetic. So if you're stressed out, can you digest your food? You can't. Look, when you're stressed out, how is your parasympathetic going to send signals out that, okay, let's get the juices going here. Okay, all the juices have gone inside, they're squeezed, all the glands are working good now. Now let's get that bowel moving a little bit here. Okay, let's close the pylorus for a while, let the stomach fill up. And who's doing all that? Who's doing all that? Who's sending out all that instructions? It's the parasympathetic nervous system. So you cannot be stressed and eat at the same time. The yin and the yang there. You can't do that. That's why don't eat when you're stressed out. You come to a lecture, you're going to get stressed out, don't eat. Don't eat in the car. Eat in a restful state. Because then your parasympathetic system is going to be helping you digest food, helping you to break it all down, sending all the right signals, doing all the right things. You cannot have the parasympathetic and sympathetic system working at the same time. Stop it. You think you can do it? And I'm multitasker? You're not a multitasker, okay? Your body is not yet trained to do that. It's a human trait. Your body is not made to do that. You cannot have two things on at the same time. You're either AC or DC. I mean, you can't be both at the same time. You'll get a short circuit, right? You'll get a short circuit. Reproduce. After all, at the end of the day, what does nature want you to do? Wants you to reproduce. Just remember that. What's the goal of life? To reproduce. Yeah, nature wants you to reproduce. So what does the vagus nerve do? It prepares you for that. Well, in order to do that, you have to be a good specimen. You got to be a strong specimen. You got to be an attractive specimen, right? You got to be a healthy specimen. So just think about it. The vagus nerve kicks in, it's preparing you to reproduce. It's going to make the best specimen out of you. Because after all, it wants only the best to be going on to the next generation. And you need to understand this. So when people, you look at them, they're really stressed out and they're having a real hard time conceiving, let's say, I'm just giving you an example. Part of the problem is stress. And the moment they de-stress, now all of a sudden, the test comes back positive. It's fantastic, right? Sperm counts go down with stress? Of course they do. Absolutely they go down. You all know that the cycles, your ovulation cycles also change because of stress. Sympathetic all the time, no parasympathetic. So you're out of sync. Too much yin and no yang. The two-way information pathway, it's not inflammation, it's information, sorry, that's a typo, it's information highway to the brain, and it's instructing the biochemistry in your body in every moment of your day. You've got to look after your vagus nerve. It is the most important nerve in the body. And then it's a survival strategy because you cannot be in one mode all the time. I already told you, homeostasis depends on the vagus nerve. What do I mean by homeostasis? This is a term that I want you to all become familiar. Homeostasis is keeping you within a certain range. You cannot be only in one. There's a little range. You've got a wide lane. So you can go to this side, then a little bit to this side. That's called resilience as well, right? That I can tolerate some stress, but then I come back to the midline. I tolerate some stress, I come back to the midline. That ability to do that is your vagal tone. If you have good vagal tone, you're going to have good resilience. That means that if you missed a meal, and 5 hours have gone by, yeah, you're going to be okay. Nothing bad's going to happen to you. Whereas the one who doesn't have resilience, he's going to be really out of shape because he didn't have a meal. Or you're in a high temperature, or you're in a cold temperature, or you didn't have the right kinds of foods, for example, or you're in a very stressful situation for many, many hours. You'll be able to tolerate that better if you have greater vagal tone. And it controls the inflammatory pathway. What does that mean? You cut yourself, of course there's going to be inflammation because everything has to be repaired now. All those dead cells have to be gone. The bacteria have to get out over there. You're going to create some water in there. It's going to swell up. But then it's going to start healing now. The vagus nerve orchestrates a lot of that. See? So we know certain people heal faster than others. How come? How come? It's because of all these pathways. Hormesis. Another term I want you to become familiar with. Hormesis. What do I mean by? And I'm always talking about hormesis. Hormesis means stress. You need to stress yourself out. Why? Because after that you'll get parasympathetic. And that's going to make you stronger. So hormesis is a stress that doesn't kill you. What kind of stress am I talking about when I talk about this? One is fasting. When you fast, that's a hormesis on your body. That's a stress on your body. It's my favorite hormesis of all is fasting. And I've talked about that on lots and lots of it. That's my favorite hormesis. Everyone must fast. Everyone must do time-restricted feeding because we're supposed to do time-restricted feeding. And then depending on your goals, whether you do 3-day water fast, 5-day water fast, depends on your goals. Do you want to reverse your diabetes? Do you want to get rid of your blood pressure? Do you want to get rid of your inflammatory bowel disease? Or are you just doing this to be healthy? Well, then that's fine. Then you can do 18-6. Or you can do OMAD if you want to do that. So it just depends on your goal. Do you want to come off your insulin? It all depends. But I love hormesis because after the stress, what happens next makes you stronger and better. And that process is orchestrated by the vagus nerve. The vagus nerve. The vagus nerve is going to get you there. So, and another form of hormesis is like heat, like infrared sauna. You sweat like crazy, you get in there and it's really sweating like crazy. That's a form of stress. And then what happens after that? How come you feel so good afterwards? Because your vagus nerve just kicked in. Because while you were inside there, you were all sympathetic. You were sweating like crazy, your temperature went up, your heart rate went up, right? You vasodilated like crazy. And then when you got out, and hopefully you got out and took a cold shower, that's even better. Now the cold shower kicks in, and that really stimulates your vagus. And then all of a sudden, your heart rate, which was up, comes down real fast. You start feeling so exhilarated, so much better. Now, of course, there's lots of reasons why infrared makes you feel good. Part of it being the photon energy particles and your electron chains and all fine. All that's fine and dandy. Bottom line is, it's a form of homeostasis. Cold immersion, also a form of homeostasis, and it stimulates your vagus nerve big time. Anytime you're stimulating your vagus nerve, you're going to get the repair process, more resilience. So, every day, turn on the shower, take a shower. It's fine, nothing wrong with that. But then make it cold or ordinary temperature for at least a minute, 2 minutes. If you can go a little bit longer, do it for a little bit longer. And then if you want to make it warm again, you can. I don't mind. As long as you went from hot to cold, or hot to cold and then out, it's fine with me. But when you get these temperature variations, what's being affected in your body? It's the vagus nerve. It's the vagus nerve. At that point, it's all about the vagus nerve. So you're stimulating the vagus nerve. So in a natural way, resilience depends on your vagal tone. I already said that it's very important that you have resilience in your body. So this is the vagus nerve. Look how big it is. It's massive. It's the largest nerve in the body, comes out of the brain, and there are two branches, one on the right side alongside your carotid, okay? Goes along your carotid on both sides, comes out, gives all the branches I told you about. So why did I mention the eyes? Because if you rub on your eyes, your heart rate will go down. You're stimulating the vagus nerve. So guess what? If you're sitting somewhere, don't do this while you're driving, but if you're sitting somewhere, you can put your hands on your eyeballs and just give it a gentle massage, not a rub, just a gentle massage. You've just stimulated your vagus nerve. And then looking to the left, looking to the right, using your eyeballs to move them from side to side. Keep that position for 5 seconds. Look to the right, keep it there for 5 seconds. Those eyeball movements stimulate your vagus nerve. See the hacks I'm teaching you? I'm teaching you hacks on how to hack your vagus nerve. The next one. I told you the vagus nerve goes along the carotid. How can I hack it? Well, take an ice pack. Those little plastic things you put in your freezer, the blue ones, right? Take it out. Or take it to work. Hey, take it to work. Put it along your neck there. Just put it there. 5 minutes. 5 minutes. It will stimulate that vagus. You'll do it. So you do it on the left, then do it on the right. And I'll say, what did you bring the ice pack for? It's not for food. No, it's for my neck. It's for my vagus nerve. That's why I brought the pack. Put it back inside, take it home, put it back in the freezer. Great idea. Now, there are stimulators for this as well. So you can do that too. You can pay a couple of $1,000 or maybe less. Buy a stimulator. Put it along here and you stimulate. It gives a little weak electric current. Some people feel it, some people don't feel it. Now, would I advise all of you to do it? No. Who is it approved for right now? It's approved for. Now, watch this. It's approved by the FDA for migraine and seizures and bad headaches. And they do it only for 5 minutes in the morning, 5 minutes in the evening. They stimulate the vagus nerve, and migraines get better, headaches get better, stress levels go down. This is amazing stuff. This is available today. It's available today. But that stimulator, as I said, I have no data for it to show that your blood pressure will come down with that. I have no data for that. Who wants to do that data study? Who's going to fund it? You see, a lot of what I'm saying makes a lot of sense, and we know from animal studies, but who's going to do this randomized, double-blind control study? Nobody's going to do it. So are you all going to wait for that? I'm saying no, don't wait for that. Just start working with your vagus nerve now. Don't go out and buy a stimulator. Just get an ice pack. Do that. All right. We now know that if a patient is having SVT and you want to increase the parasympathetic tone with SVT, supraventricular tachycardia, we tell them do gentle carotid massage. And that slows the heart rate down. So we know these hacks already in cardiology. I am saying do that for cardiology, fine, but also use it in your day-to-day life for stress management, blood pressure management, all around better health. I'll show you more data on that. So here's another hack right there. Another one is humming. If you just sit for 10 minutes and go, that vibration stimulates the vagus nerve. And if you measure people's heart rate when they're doing that, it goes down. Measure their blood pressures, it goes down. Humming does. Another one, laughter. So the laughing club. Start a laughing club. The more you laugh and be good belly laughs, you're stimulating your vagus nerve. Pulse rate goes down, blood pressure goes down. So who doesn't have early hypertension? Everyone today is having hypertension. Well, then go on and start laughing. Start laughing, start humming, start singing, even gargling. So I told you that it goes to the glossopharyngeal muscles. So take some saline or even plain water and but gargle loud, like you really mean it, not just you gargle hard. There should be a couple of tears come out from your eyes. Now you're really stimulating your vagus nerve. And that is going to definitely give you a lot of benefits. So right there, so there's another hack I just taught you. Now the biggest hack is the breathing that I already mentioned right in the beginning, where you breathe in, but you breathe out long, prolonged expiration. That because you have very large amount of representation in your lungs. Your lungs, they have a huge representation of the vagus nerve. So hack it. That's a big nerve. Because there are small nerves that can be hacked as well. There's one that you'll read about, because now I know you're going to go home and start looking up vagus nerve, blah, 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 blah. But there's one called the tragus nerve, which is here, right here on your ear, right here. Right in the front. This little piece sticking out here? That one. And if you press on it hard enough and massage it, and sometimes you can put your finger on the inside and massage it too in that way, it does trigger your vagus nerve. But I think I'll be looking funny if I'm doing that and someone's walking by. But there are instruments you can buy that actually stimulate this. But what I'm trying to tell you is that yes, those things do work. There are easier, cheaper, free ways to stimulate your vagus nerve starting today. Start hacking it today. So then it comes down here, and then it comes into all the gut area here, okay? So in the gut, it breaks down by the stomach into two branches. One goes to the front, one goes to the bottom and out, and it goes down to your colon. So why am I so interested in what's going on in the gut down here? Well, you all know I'm very interested in the gut. Why am I interested in the gut? Because there's another huge representation that my vagus nerve in my gut will affect my brain and can affect my heart as well. And my vagus nerve over here is going to affect my leaky gut and my microbiome as well. And I already told you all that I believe that all inflammation starts in the gut. All inflammation starts in the gut. So anything to do with the gut, including the vagus nerve, is of interest to me. If I can hack your vagus nerve and make your gut work better, you will have less metabolic endotoxemia. That means your leaky gut will be less. Therefore, things that should stay in the sewer will stay in the sewer and not get into your bloodstream. If you have a leaky gut, as a result of dysfunctional vagus nerve, or your vagus nerve is not working properly for multiple reasons, which I'll show you in a minute, you're going to get more leaky gut. If you get leaky gut, you get lipopolysaccharides and interleukins and other inflammatory molecules getting out from your gut into your bloodstream and then going to your whole body and causing inflammation. Chronic inflammation. Most diseases today are chronic inflammation. Look, you guys are not dying of dysentery or leprosy and all those bad things, right? So it's very important to understand this chronic inflammation. Where does it come from? Where does most inflammation come from? It comes from your gut. Now, sometimes we also do bad things. We put things on our bodies and whatnot on our body. But things comes from your gut. That's the biggest threat you have. You have what? 100 trillion bacteria in your gut. And not only that, but you got the wrong bugs in your gut. Fine, you got 100 trillion, fine. But you got the wrong ones there. Why? Because you killed off the good ones, right? So when the bad ones are in your gut, what are they doing to your vagus nerve? They're stimulating it. They're making it dysfunctional. So when those bacteria produce bad substances, neurotransmitters, they'll go up the vagus nerve and they can travel all the way into the brain. Now that should scare you. Do you want your bacterial products to travel up all the way to the brain? So there's a strong correlation between what's going on in the gut and some of the neurodegenerative diseases, which is a whole new topic we can talk about, such as Parkinson's and also with other movement disorders. So Parkinson's is huge. A lot of Parkinson's going on. Everyone knows somebody who's got Parkinson's. Dementia, inflammatory conditions in the brain. How did they get there? Well, these things can get in through the blood and they can cross the blood-brain barrier. But they can also get direct entry into the brain through your vagus nerve. Did you know that? That you can actually get direct entry into your brain through your vagus nerve. And there are studies now showing that particles that were found originally in the intestine ended up in the brain via the vagus nerve. So I say that the vagus nerve here is very important. Plus, you got to remember, when you have the wrong bacteria or you have inflammation in your gut, or let's say you have food sensitivities, like you're allergic to wheat germ agglutinin. Oh, it's horrible. Wheat germ agglutinin is the number one thing that I'm finding in my patients who have either got autoimmune diseases or coronary artery disease or hypertension, metabolic syndrome. The one thing I'm finding is wheat germ agglutinin allergy. So it's really a sensitivity. It's not gluten only. People think of celiac disease. No. So what happens with wheat germ agglutinin is it causes inflammation here in the gut. So the first thing that's going to get affected by that, or one of the first things that's going to be affected by the inflammation in the gut, is the nervous system in your gut. It's called the enteric nervous system, right? That's the nervous system of your gut. After the brain, the second largest neural network is in your gut. Now, if it is supplying your intestines and your intestines are all messed up, what's happened to that vagus nerve, enteric nervous system? It's messed up. So it's sending wrong signals to the brain from the gut. And those signals, remember, it's a two-way channel. So they're going up and down, and in between there's your lungs, there's your heart rate. No wonder you get all sorts of vasomotor and vasovagal symptoms when you have gut problems. I'll give you an example. A patient came to see me the other day, and she had what is known as POTS. So she had a very high heart rate all the time, and when she stood up, her blood pressure would just drop all the time. Why? Because she got autonomic dysfunction. Because look, when you stand up, your autonomic nervous system is supposed to fix everything, right? It's supposed to fix everything by vasoconstricting you. Well, she had inappropriate sinus tachycardia all the time. She also had POTS. So in talking to her, I started concentrating on her gut. And she said, "Excuse me, I thought you were a cardiologist." I said, "I am." But it turns out that she had classic symptoms of small intestinal bacterial overgrowth. And I treated it. I gave her some of my herbal preparations, no antibiotics. I just gave her herbal preparations. And she came back a month later. She's saying, "Oh my God, I finished this." And I, of course, put her on some quercetin and some curcumin later on and some other special essential oils. And she got better. And she says, "I'm no longer fainting. My heart rate has come down. I feel like I did before. It's so good." I fixed her heart rhythm through her gut. And I'm saying this all the time. That arrhythmias, blood pressure anomalies, especially orthostasis, autonomic dysfunction, because this is autonomic nervous system, starts in the gut. You fix the gut. You hack your vagus, fix your gut, hack your vagus, and your autonomic nervous system will reset itself back to where it should be. So you're no longer running sympathetic all the time. So the gut is really, really important, your enteric nervous system. So when the enteric nervous system goes wrong, the nerves of your gut, what symptoms are you likely to get? Constipation, because it's just not working, or diarrhea, where it's working too hard. It's dysfunctional. You want to fix that? You need to fix your gut. The enteric nervous system will get better. When the enteric nervous system gets better, your bowels come back to normal, and your diarrhea goes away, or your constipation goes away. You've got to fix the enteric nervous system. The nervous system in your gut is the vagus nerve coming down and spreading it. And this vagus nerve, it is such a vagabond. Literally every millimeter or so in the gut has one of its endings. So you've got to ask yourself, what's it doing there? It's feeling everything out. And it's sending back signals to the brain. And we just underestimate this whole thing. We definitely underestimate this whole thing. Hack your vagus nerve, those enteric nervous system will get better. Your gut will get better too. You having any type of GI symptoms? Start hacking your vagus nerve today. And tell me if your gut symptoms didn't get better. Now, of course, some gut symptoms are not only due to enteric nervous system, they are due to bacterial overgrowth, like that girl I was telling you about. Right? She had SIBO, and others have food sensitivity issues where they need to stay away from certain foods. So we do the blood tests to see which foods are you sensitive to. We do that. If they're having real bad bowel problems, then I check their stools to see which bacteria are missing or which ones are in excess, or what can I do to rebalance them. And then we give them fermented foods. We give them high doses of fish oil. So wait a second, what does fish oil got to do with all this? Well, fish oil has omega-3, and guess what's all these neurons made up of? Omega-3. So wait a second. If you're not having omega-3 in your body, or enough of it, and I know you don't, right now I'll tell you don't, you've got a vagus nerve that's not working optimally. I'll just tell you that right now. You see, our omega-3 levels today are so low, it's unreal. I have yet to see maybe 1 out of 40 labs that come back with the omega-3 levels are optimal. It's called omega check. Nobody even checks for it. And the worst part of it, it's not just omega-3, they have too much omega-6. So it's not just omega-3, it's the ratio of omega-3 and 6. So if you have a relatively low omega-3, it's okay if you also have very low omega-6. Because it's the ratio that really matters more than anything else. But these days, we are all toxic with omega-6 because we're all eating vegetable seed oils. And then we eat nuts that have been roasted in vegetable seed oils. And we go out and eat too much, and all they use is vegetable seed oils. And you're paying for it too. And tipping them on top of it. Too much omega-6, too little omega-3. Omega-3 is needed especially for one big nerve in the body, and that's your vagus nerve. That's your vagus nerve. You got to have omega-3. You have to take omega-3 supplements. Now, if you're a total vegan and you can't take fish oil, well, where does omega-3 come from, by the way? Oh, it comes from fish. Well, actually, it doesn't even come from fish. It comes from algae. And the algae get eaten by small fish, sardines, all those, and then they get eaten by bigger fish, eventually it gets to you. The farm ones have no omega-3 in it, because I don't see algae down there anyway. So you're going to be careful about just hoping that you're getting all your omega-3s from fish. Good luck, unless you're really eating only wild-caught salmon every day, and then you also got to eat a lot of it. But then, that's not my advice. My advice is, look, it's easy. Hack the system. Just go and get omega-3 supplements and make sure that it doesn't contain PCP or dioxin or mercury. So you get a high-quality fish oil. If it smells bad, it's no good. If it tastes good, it's probably okay. It mustn't be rancid. And once you get it, put it in your refrigerator so it doesn't get rancid. Rancid means what? Oxidized. Because if fatty acids get oxidized, they're really bad for you, right? It causes small dense LDL, causes lipid peroxidation, blah, blah, blah. All the things we talked about on other shows. But bottom line is, you want a healthy vagus nerve. A healthy vagus nerve is full of omega-3. And you must hack it frequently. constantly hack your vagus nerve, then that pathway will be facilitated, as we call it. So here we go. So it stopped here. Oh yeah, okay. I saw another girl the other day. She was having gallbladder issues. So her gallbladder wasn't working. So what innervates the gallbladder? The vagus nerve, right? So with her, we did the same thing. We worked on her gut, and they said they were going to take her gallbladder out. And I said, yeah, well, you've got to follow the instructions, but just try this. And she did, and her symptoms got better. So she didn't have a gallstone. So what was the problem? She had a lazy gallbladder. So they give you this little medication, and then they look at your contractions on your gallbladder, and her gallbladder just wasn't contracting properly. And sure, that'll cause a lot of problems, right? So my solution for that was, listen, just wait a month. Try this. And we worked on her gut. And we worked on her motility and her vagus nerve function. And she did exercises, vagal nerve exercises, and she still has a gallbladder. So I just think that it's very important. Now, I'm not saying that all gallbladders must stay in even if they have stones. No, I'm not saying that. I'm just saying that there's lots more that meets the eye. Let's just be a little sensitive about this too. The kidneys are important, the colon I already mentioned, and the heart and lungs. Of course, they're in capitals because that's to me, that is really important. Inflammation. So the vagus nerve has a two-way traffic, I already told you, and you must hack it. It is the software that's running your system. Look, if there's one thing you must take home today is to understand that your hardware requires a software. That software is your vagus nerve. You must have a healthy vagus nerve. Tells everything what to do. Oops, I went too far ahead. So what is this? This is heart rate variability, right? It's just showing that beat to beat, there's a slight change in your heart rate. And that tells you have a nice heart rate variability. That's good. That's good. That means you have a lot of vagal tone. So sympathetic shrinks, parasympathetic, the interval gets longer. I like that. This was a study that I wanted to show you all. Long-term effect device guided slow breathing on blood pressure regulation and chronic inflammation patients with essential hypertension using a wearable device. So basically what they did in this study is that these patients had breathing exercises that was guided by a cell phone app. So the cell phone app tells them, okay, breathe, now don't breathe, now expire, now take a deep breath in. So it guided them through a breathing pattern, okay? Now, why was I interested in this? Because I told you that all he's doing when he's doing this is he's hacking the vagus nerve. That's all he did, right? Right? And look at the results. There was a significant decrease in blood pressure after 1 month of exercise. How did the blood pressure come down? Because bringing down the blood pressure is the job of the parasympathetic nervous system, the vagus nerve. And a significantly continuous decrease in TNF alpha was also, what does that mean? A significantly continuous decrease. It kept going down. TNF. What is TNF? Tumor necrosis factor alpha. So that's an inflammatory marker. So when I'm doing your advanced lipid panels, starting now, I've been doing them. It's the Cleveland Heart Lab stuff that I'm looking at. I'm looking at interleukin-6. I'm looking at tumor necrosis factor. Unfortunately, some of the insurances don't want to pay for it. But this tells me that if your tumor necrosis factor level is high, you have a lot of inflammation in your body. And didn't this study just show me that I can decrease it? Just by breathing? How cheap is that? So who's going to pay for this study in the future? Nobody. Because you don't get paid by telling somebody to take a nice deep breath in but a long breath out. So there you go. The baroreflex indices were also significantly increased. Heart rate variability did not show differences at this time. That's because there were other factors also still in the patient. And the positive correlations between sympathetic index and this is, there you go. So the sympathetic all went down. Tumor necrosis factor levels also went down. Slow breathing exercises have a beneficial effect on blood pressure and chronic inflammation. You become uninflamed when your vagus nerve is stimulated and hacked by you by breathing. So just pay attention to your breathing. You see, the autonomic nervous system is autonomic. It works on its own. But you can also control it. You can override it. And the best way to override it is your breathing. See, if you don't pay attention to your breathing, you're still breathing, right? It's automatic. But I can hold my breath. I can breathe out hard, so I can also override it. So I'm saying to you, do it. Do it. Whatever it takes, do it. I don't care what form, I don't care which yoga class you go to, or whether you just do it at home, or whether you do Tai Chi, or whether you do postures, or whether you use a machine to guide you, or whatever you want. But just do it. This one is a device versus non-device guided slow breathing to reduce blood pressure. This is another systematic review. Modest blood pressure reductions. Low-level vagus nerve stimulation suppresses post-op atrial fib and inflammation. I love this study. Why? So in patients who have surgery, open heart surgery, they often go into atrial fibrillation. At least 20% of the patients go into atrial fib. Now, my interest in atrial fib is that why do they go into atrial fibrillation post-op? And we say, well, it's the irritation of the pericardium, and there's blood around the pericardial space, and blah, blah, blah. But I'm saying there's something more fundamental at the biochemical level. There's something else. And it's an imbalance between the sympathetic and the parasympathetic system in these patients that throws them into atrial fibrillation. So surgery is sympathetic. Of course, surgery is very stressful. Your adrenaline levels are high. Your intramyocardial catecholamine levels will be really, really high. So if a patient goes into surgery with high vagal tones, he's healthy, he's been doing all this stuff, he's likely going to have less atrial fibrillation post-op. So here what they did is that they did low-level vagus nerve stimulation. So what they did is, after the surgery was done, the surgeon implanted a little device right on the vagus nerve and gave it a little energy, the vagus nerve post-op. And what happened to the incidence of atrial fibrillation? Let's look, conclusion. This is low-level vagus nerve stimulation, LLVNS, suppresses post-operative atrial fibrillation and attenuates inflammation also. Wow, inflammation also. Now you got my attention because I'm all about inflammation, because what causes coronary artery disease? Inflammation. What causes chronic diseases in humans? Inflammation. What is it we all suffering from today in this world is inflammation, right? There you go. Yeah. So there you go. That's what I'm interested. So let's see in this group what happened. Okay. So we saw that serum tumor necrosis factor. There he shows up again. Interleukin 6, significantly lower in the group that had vagal nerve stimulation. So how is that possible? Well, the vagus nerve, I told you, is a two-way traffic. It sends the signal from here to the brain. The vagus nerve got stimulated, says, that's good. Everything is hunky-dory. The signal it got back. The king is sitting in his chair, and his scout went out and checked it out and came back. And who's the scout? The vagus nerve is coming back, right? Telling it, everything is hunky-dory. How did it know that? Because the vagus nerve was being stimulated, right? By the electricity was coming. It's good. Vagus nerve is stimulated. That's great. So the king said, that's all right. That's great. Bring back the horses and bring back the men. Stop the inflammation. If that signal was not coming, you'd say, oh my God, there's no vagus activity. Oh, Jesus, this is terrible. Terrible news. Inflammation will be ongoing inflammation. So it turns off the inflammation. Next, these are the exercises. I think I already told you some of these. Oh, by the way, this balloon blowing, I didn't tell you about the balloon blowing. So when you blow a balloon, you're raising the intrathoracic pressure. That stimulates your vagus nerve. And I'll show you some slides later on to show you how people take advantage of that, and we'll sell you a little machine. Well, wait a second. Let's get a balloon. Do it yourself. Play with the balloon. Do something useful. Play with it. Then laugh. Now you'll get a lot of vagus nerve activity. So ice water, ice pack to the neck, Valsalva. So Valsalva is when you take a breath in, you breathe in, and then you pretend like you're going to breathe out, but you don't. You close your glottis and you strain. And when you strain, what's happening is you're increasing the abdominal pressure. And the vagus nerve that supplies all the intestine gets squeezed. And you get an intense increase in your vagal nerve. That's Valsalva. We do that in patients who have SVT, supraventricular tachycardia. When they go into that runaway rhythm, we say, okay, now sit down and push. And they do that, and boom, the SVT breaks because you increase the parasympathetic. You can do that too. Not because you're getting SVT, but just do it for fun. So you're at home, feeling a little stressed out, you don't have a balloon, then just do a couple of Valsalvas. See, a couple of those rounds, it's fine. People say, what are you doing? You're having a bowel movement? No, I'm not. It's okay. Do it. Yoga postures, meditation, humming, gargling. I mentioned all these cold water shower. Now this hit, I put it at the bottom, that's an intense activity. I really like this. I think this is, because that's what I do. Look, I don't have time to go to the gym for an hour. I don't know how many people got time to go to the gym or get on that treadmill and do all this. I don't have time for that. So I do short bursts of activity real fast. It takes me literally minutes. But as soon as I'm done with that rapid activity, then I just totally rest. And no one's even around. I just do it on my own. It only takes me a few minutes every day. Every day. It just takes me a few minutes to do it. That's it. And that's how I like to do it. Intense activity with intense rest. Intense rest. See, nobody ever told you that. They just told you to do intense activity, didn't they? Why didn't they tell you to do intense rest right after the intense activity? That's what I like to see. I want to see that you facilitate the yin and the yang. Do intense, fast activity to maximum ability that you can. And then just lie down and rest. So one of the ones that I do, which I like, is the hands on the knees. You know, when you jump up real fast and just do that just for about a minute or so. And then you're really huffing and puffing. Your heart rate probably goes to about 150, and then just lie down. Lie down. And you'll find that you'll be able to hack your system much faster and better. So the enteric nervous system I already talked about. Dysbiosis, I'm coming back to this because I put the slide up because, look, I'm telling you, the gut is huge. Yeah, it is huge. Most of us have a big gut. And the nervous system in the gut is very important, so you can hack that, and it can hack you. That is why if you got a gut problem, your life is miserable. Just think about it. If you have a gut problem, your life is miserable. Why? Why is your gut so important to you? Because it's the home of the largest nerve in the body, your vagus nerve. That's why your gut is important. That's why you need to make sure what you eat is right, when you eat is right, how much you eat is right, what you eat in terms of fiber and your bacteria is very important. Probiotics are really important. If you're missing them, fermented foods are very important. Fiber is very important. Right. So there you go. So CNS inflammation, I already mentioned, mental fog, depression. Oh yeah, look at this one. Mental fog, depression, and anxiety. Do you know how many people, we have an epidemic right now of what? Of depression, of mental fog, of anxiety. Heck, everyone's anxious these days. Have you noticed everyone's like a cat on a hot tin roof? Huh? Everyone's going through so much stress in their day-to-day life. For whatever reason, we're just going through all this. You need to start hacking your life so that you can get rid of all that. And the best way to get rid of this is watching your diet, fix your gut, fix your enteric nervous system, hack your vagus nerve. Very important that you do this in this part. Now, of course, I always talk about my insulin levels and I talk about sugar. That's a different talk. That's very important also, your hormones. But this is very important too. So there you go. All right. So parts I told you about, inappropriate sinus tachycardia, syncope, fainting spells. How many young people I'm seeing every day fainting all the time? Fainting all the time. You do a tilt table test on them, they faint. Blood pressure went down to 70. Heart rate 50. So they're all having vasovagal symptoms because their vagus nerve is not working out. It's too active in them. Overactive vagus nerve is also no good. You see, when a nerve becomes dysfunctional, it can stop working or it can become really irritated. So you can get diarrhea, you can get constipation. See, both ways. It can go both ways. So your vagus nerve can cause both problems, too much or too little. PVCs and PACs, palpitations. The balance of your electrical system in your heart is based on the yin and the yang, the sympathetic and parasympathetic. If I give you a shot of adrenaline, you're going to get PVCs. But if I give you a shot of adrenaline and I stimulate your vagus nerve at the same time, you won't get PVCs because the balance is there. So who's not having palpitations? I see them in my office every day. Oh, palpitations, doc, I'm having palpitations because you're imbalanced. Your yin and the yang is out. Atrial fibrillation, orthostatic hypertension, constipation, diarrhea, SIBO, gallbladder dysfunction. I already mentioned all this. So then buy this little gadget here. You can buy this little gadget. It teaches you can actually dial it up for how much resistance you want for inspiration, how much resistance you want for expiration. And you can buy these little gadgets. But my favorite gadget is this one here. This is the Respirate. It is my favorite gadget. So you can buy this on the internet. It's been approved by the FDA for lowering blood pressure. So what am I interested in? I can rather give a drug, right? No, this is really good. This is equivalent to at least one medication. What it does, it's very simple. This is very easy. You see these little buds over here? You pull them out and you put it in your ears. And it gives you a tone. And then a separate tone. And you just follow it with inspiration and expiration. So now you have a teacher basically telling you how to breathe. So it'll first listen. There's a strap that goes on your chest. It listens to your own breathing pattern of what you are doing right now. And then over the course of the next 10 minutes, the machine slowly increases the inspiration, but more so expiration. So at the end of this, you hopefully should have a breathing rate of about 8, 9 times a minute. When's the last time you breathed only 8 times a minute? You see my point? Breathing 8 times a minute more effectively by following inspiration and then prolonged expiration. It's far more effective in doing gas exchange, and at the same time, it's stimulating the vagus crazy. So blood pressure comes down. When you do this, you only need to do this 10 minutes in the morning, 10 minutes in the evening. Now, I like it not because it lowers blood pressure only. I actually think that no tests have been done on this. Meaning, nobody's gone in and measured interleukin-6 levels or tumor necrosis factor levels with this. Nobody's measured heart rate variability changes. But those studies are there. They are in smaller studies and they are in animal studies. But we need bigger studies. But the problem is, who's going to fund those studies? But this is so good. And basically, it's doing what we talked about earlier on. It's hacking your system. But it's a machine-guided hack. So I do like this very much. I think this machine will help your guts as well. But this machine costs about between $100 and $200 to buy the machine. Yeah. I know it's exactly been an hour since I started. But I think that the vagus nerve is very exciting. It's exciting because nobody's done anything much with it. I'm saying it's the most accessible nerve because I can't hack my trigeminal nerve. I can't hack all my other cranial nerves. This nerve, I can hack it. So, happy hacking. Thank you. Okay. Yes. Sad to say, yes, it's true. You must have heart rate variability. If you don't have heart rate variability, you have inflammation going on somewhere. You need to find it and eradicate it.
Super high methane levels?
Pardon?
Super high methane levels?
Super high methane level means that you have the wrong bacteria in your large bowel and they need to go because they are either producing noxious agents or not producing the anti-inflammatory ones that you should be producing, such as, so the wrong bacteria will not produce short-chain fatty acids. The short-chain fatty acids are butyric acid, acetoacetic acid, propionic acid. They are not being produced. And because they're not being produced, they are anti-inflammatory. They'll increase your heart rate variability. So it's either that those are not there or these guys are producing bad stuff.
So rifaximin versus your natural?
I prefer the natural always. So there's one called Candibactin A, Candibactin B. It's a 14-day course that you take, and because this is colonic, you need to be a little bit stronger. You also need to take quercetin every day, and you must take curcumin, 300 milligrams twice a day. And then once you finish the 14-day course, then you must take essential oil of clove, 1 drop, oil of oregano, and oil of cinnamon, 3 drops. So 1 drop of each once a day, and then after about a couple of weeks, you go to 2 drops of each, and then you end up at about 3 drops of each. That's it. And the way I do that is I would tell them to just take a little bit of olive oil, just half a teaspoon, and just put the drops in it, and then just take it and put it in your salad, or you just take it yourself. That'll help you. And then the last thing you need to make sure is if you're still having a problem, is check for fungus, that you could have fungal infection too. And there's a course of herbal treatment for that as well. Now, the rifaximin you can do, but it's very expensive, and I just don't like to kill bacteria.
I thought it doesn't kill the good bacteria.
Yeah, and it kills the good and the bad and the ugly, all of them. So I prefer not to. Yes, ma'am. Yes. So let me tell you about sleep apnea. See, people think, you see, now I'm going to ask you, you think that sleep apnea is only because of obstruction, right? Now, that is true. If you have a big glottis here and you're snoring a lot at night, that's sleep apnea, right? So your brain thinks that you're choking, you're going to die. So instead of letting you go into deep sleep, it puts you into shallow sleep. And when you're only in shallow sleep, guess which nerve is shut down? Your vagus nerve, right? So yes, it does sleep apnea. But your question was, does this cause sleep apnea?
Does it help to heal?
That's right. So you want to get rid of your obstructive sleep apnea. But I'm going to tell you something else. The patients who have sleep apnea, they can reduce the fat in the tongue and the glossopharyngeal muscles and all that by fasting. So if you fast and when you lose weight from fasting, the muscles in the tongue, they shrink first. Because the tongue is very full of fat. The tongue is 90% fat. So it just fades away, snoring gets better, they start sleeping better right away. So fasting is number one for that. And then the other thing I want to tell you is that when you do have vagal nerve dysfunction, generally, then when you do sleep, you're not going to sleep as well either. You're not going to go into good deep sleep, because your vagus nerve is not coming. So yeah, the vagus nerve kicks into just about everything. So let's say you have a really dysfunctional vagus nerve. You will wake up fatigued and tired in the morning. Because the vagus nerve, even though the brain said, turn on vagus nerve, it just didn't turn on properly. Yeah? So there you go. Yeah. So sleep apnea is very important. You got to get that treated. You got to get rid of sleep apnea. So temporarily, you may need a mask, but after you lose the weight, then the sleep apnea is gone. Now, there are 2 other forms of sleep apnea you need to know about. One is bruxism. So if you're grinding your teeth a lot at night and the dentist looks at your teeth and say, oh my God, these mountains are all now flattened out, all the peaks are gone, you have to get a mouthpiece and work on your bruxism. There are ways to get rid of stress related. So you should be doing this, meditation, relaxation, blah, blah, blah. So that is very important because that interrupts with your sleep upset. And then the second thing is restless leg syndrome. So restless legs also cause the sleep disorders. So if you are iron deficient and you have restless legs at home, for example, then that will keep your brain awake all night. So even though you slept for 8 hours, you wake up in the morning fatigued and tired, and you're having the same effect as if you have obstructive sleep apnea.
There's also central apnea.
Central sleep apnea is a category in itself. It's central sleep apnea. Those patients usually have either congestive heart failure, severe left ventricular dysfunction, or they've had a stroke. So these patients breathe and then they just quit breathing. Not because they're obstructing. It's just they're not getting the message from their medulla telling them to take a deep breath in and out. They just stop breathing. And the pH in their body and the senses are all messed up, and therefore the stimulation to breathe is gone. Central sleep apnea is a problem. But central sleep apnea can also be partly treated. Sometimes with low-dose CPAP, and sometimes there are some medications they can give you for central sleep apnea. Yeah. And, medications often cause central sleep apnea as well. So you got to really look at the patient in a whole to see, why is this patient not breathing at night? Why does it quit breathing at night? Central sleep apnea can also occur if someone has obstructive sleep apnea and is using a mask and the settings are not right. Then they can go into central sleep apnea.
Serotonin contribute to sleep apnea?
Low serotonin can, but it's more related to just your general affect. It affects you in your ability to get to sleep, stay in sleep, and go into deep sleep. Because you need serotonin to go into deep sleep. You see what happens? Tryptophan. Why do I give tryptophan to everybody? Just about every patient comes to my office, I give them. Because tryptophan gets converted to serotonin. Serotonin then at night gets converted to melatonin. Melatonin, by the way, is very good for your mitochondria as well. Melatonin, fantastic for the mitochondria. So I give that because of serotonin. So when you have a good serotonin level in your body, you're going to sleep better. And in the mornings when you wake up, you don't feel better. You get uninterrupted sleep. You feel so much as serotonin. What a great question. I love the question. The question is, how come these people are working all day long, living in a big crowd with everybody, and yet they're living well into their 90s without significant health problems? Because remember this, and actually I should have said this in my lecture earlier on, that the vagus nerve starts in the midbrain, right? But it has lots of rostral connections. Rostral meaning from the front. So your prefrontal cortex, your frontal cortex, your hippocampus, your amygdala, all that has connections to your vagus nerve. So if I am stressed out all the time because I have a certain philosophy in my life about relationships, how children should be, how parents should be, for example, living in that family situation. If I'm stressed out all the time, then my cognition, my ideas is going to affect my vagus nerve. And then I'll get vagus nerve dysfunction, right? So, and then you'll get ill, chronic diseases. These people don't, because they have a life philosophy. A life philosophy that will allow your vagus nerve uninterrupted and let it be what it needs to be. So your life philosophy is very important. So I'm going to name the life philosophy important things. Number one, living in the moment, right? They live in the moment. Number two, they don't drive looking in the rear view mirror, right? They don't look at the past, and they don't hold grudges. Right? Number three, they don't neurose about the future. They do what they can in this moment, and they move along with that, right? This is very important, right? Number four, they have a meaning in their life. That means they bring meaning into their life. They do certain things, they know it's meaningful to them. To this person, that's meaningful. That's meaningless stuff. You just washed the car. But to me, it was something meaningful. It brought me a lot of pride and joy, and I felt good about it. My meaning. So they bring meaning into that. Whatever you do, it brings meaning into that. So that is very important. Friend circle, social support, very important. When you have social support. So now let me tell you about the vagus nerve, okay? So here I am, and I don't touch. When I touch someone, or you touch me, let's have you touch me. You come touch me, that means you're not my enemy, right? You caress me, you hold me. That means I'm now saying you're not my enemy. So which one do you think is working, my vagus or my sympathetic? My vagus. You just turned on my vagus nerve. So therefore, when you have pets, and you can pet a dog, who's getting the benefit? The dog? No, you're getting it. Because your dog's your friend. You love it. You're getting a meaning out of it. And when you pet that dog, your vagus nerve goes up. Your vagal nerve stimulation is good. So what I'm saying is that your whole life affects your vagus nerve. Everything from what you think, from how you, as I said, the touch, the loving feeling, the being around the people, the music you hear, the language that you hear, the tone of somebody. Let's say you came and you talked to me and you were really screaming your head off at me. Which sympathetic, what happened to me? My sympathetic went up. My vagus went down, right? All of a sudden, right? But if you came to me and you had a nice demeanor and you had a nice, you are no threat to me. So what is this? This is a very interesting thing. This is called, you are not presenting an existential threat to me. I feel safe. Similarly, existential threats come from society, from the government. You get taken away your Social Security right now, your vagus nerve is going to be dead for months. Because you see an existential threat. People who live in societies like you're talking about a household, they don't see an existential threat. The psychology of the household is such, it's reaffirming each other. It's consolidative. It holds people together. They know that even if they make a mistake, they're not going to be thrown out on the street. See, there's no existential threat. We must not pose an existential threat to each other, because the moment you pose an existential threat, your vagus nerve shuts down right away. And now you have only sympathetic, you only have inflammation. Welcome to modern living. Because every day, I bet you every day you are having a sense of existential threat. Are you or not having feelings of existential threat every day? Or are you having a lifestyle where you know you're safe? You're going to be okay. I get existential threat when I go shopping. Because I don't know what I'm buying. I don't know what's in it. Well, no, now I know better. Now I know better. I know how to read labels. I know what to stay away from. I know what to eat, what not to eat. But you know, it is this existential threat that we're all facing every day, whether it's rules, regulations, or whatever it is, or relationships, or expectations, or monetary, or whatever it is. There's too much existential threat today. And that connects to your vagus nerve. So the difference is, you get sick, how many people are going to come visit you in the hospital? 2 people or 25 people? 25 people, your vagus nerve is flourishing. You'll be out of the hospital in 4 days instead of 30 days. And you'll have less complications. You'll recover from your surgery faster. Those studies have been done. Your recovery rate is clearly related. Now, how can your recovery rate be clearly related to the number of people that came to visit you? They didn't give you a medicine. They did. Because when they came to visit you, they gave you a dose of vagus nerve. Do you get it? They just bumped up your vagus nerve. So we should be dishing out vagus nerve function to each other, and that's what we need. We need vagus nerve stimulation. That's what it's all about. So yeah, you're right. So what we didn't talk about here is what I call the psychosocial predictors of health. For example, I'll give you another example. Let's say you're at work and you're at the lowest ranks and people are trotting on you all the time. But you have access to the same health care as the boss because the company has the same insurance. You're going to die sooner, get more diseases than your boss. Because you had no control. So that causes an existential threat in you as well. Because you have no control over can't say what I want to, can't do what I want to. I'm not in control of my time, my environment, how I do things. That's huge. This was the Whitehall study that was done in England. So it's been shown. So your whole life is affecting your vagus nerve every day, in every which way you look at it. It's not just what we're putting in or our physical environment or the air we're breathing in or the chemicals, blah, 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 all the things I talk about in your gut and everything. That's just things that you can hack. But ideally, you also want to hack your psyche. Change your mind about everything. Live in the moment. Release the past. Be forgiving. Forgive and forget. You will be really, and get a pet. You're going to live long. Your vagus nerve will be fine. Really. Yes, ma'am. Perimenopausal women. Okay, so women will not tolerate fasting right before the period. So in women who are not menopausal, I'm just saying for them, right? Right before, you shouldn't fast. You should fast after your period. You'll tolerate it better. That's one rule. The second thing is that in the perimenopausal phase that you're going to, fasting is actually beneficial. Because when you're fasting in the perimenopausal phase, you're going to get lots of good physiological changes. BDNF, which is brain-derived neurotropic factor, gives you more plasticity. Your brain actually was better, you're brighter. So you are less succumbing to the symptoms of vasomotor activity. Number 2, vasomotor activity. What is that? That's flushing, right? You suddenly flush, you feel hot, you start getting sweaty, all the perimenopausal symptoms that you get, right? Those are all controlled by what? Sympathetic. So now you can offset that with parasympathetic. More vagal activity is needed for perimenopausal symptoms. Do more vagal activity, because now you got to overcome regular stuff plus the vasomotor symptoms as a result of the drop in your estrogen levels. Estrogen levels drops.
I'm in my 40s. So is it advisable to fast after the period, like a week after my period, and then continue back to eating regularly?
Correct. Correct. So long as you're still having periods, I wouldn't fast right before my first 14 days ovulation, up to ovulation. After ovulation, then you can fast. So you should know when you're kind of ovulating, and then you fast after that.
People have to.
If you liked this video, here's one that I would recommend. And if you want to see my latest video, please click here.